Now.
Yes, sir.
So I welcome you all on behalf of RSSDI. I welcome all RSSDI members who joined us on Facebook as well as on YouTube Live. I welcome all past presidents, executive committee member of RSSDI, and all Rotary members who have also joined us on this virtual platform. I am Dr. Bansi Sabu, currently president of RSSDI. Many of the Rotary members who may not know about RSSDI is one of the biggest organization in our country. We have more than 9,000 members who are practicing physicians and diabetologists. This program which we are doing today, actually the Defeat Diabetes campaign we started on 1st July, which was inaugurated by our Chief Justice of India on 1st July, Doctor's Day. It was for 3 months, 100 days to reach 100 million. Today we are here for 1 million tests, which we are going to do tomorrow. And tomorrow is a World Heart Day. So now I request Dr. Amit Gupta, who is coordinating this program. He is task force member of RSSDI Defeat Diabetes campaign. So over to Amit to talk about 1 million tests, which we are going to do. And then I will request Dr. Vasant Kumar to welcome formally everyone. Over to Amit.
Thank you, Dr. Bansi Sabu, sir, for giving this opportunity to be here and present this 1 day, 1 nation, 1 million test campaign. Tomorrow, as you all know, is the World Heart Day. And RSSDI President Dr. Bansi Sabu, along with the entire EC, decided almost 85 days ago and declared a Defeat Diabetes campaign, which has been successfully running for last so many days. And today is a very, very important day, and it is a milestone in the journey of this campaign, where we have planned to test almost 1 million people tomorrow at more than 10,000 sites, which have been created all across the India, with the help of RSSDI members, Rotary India, Art of Living, Beto, and Torrent. So it involved a huge logistic, and tomorrow we are also going to attempt for the Asia Book of Records, and this has never been done or attempted anywhere before. So it is going to be a big day, and I must thank all of you to be a part of this journey since the inception of this campaign. And tomorrow, with the support of each and everyone, this 1 nation, 1 day, 1 million campaign will be a huge success. Over to Bansi, sir, and now we can proceed.
Thank you. First, I welcome Dr. Vasant Kumar. Dr. Vasant Kumar is a president-elect of RSSDI. He is a senior diabetologist and physician practicing at Hyderabad. So I request Dr. Vasant Kumar to formally welcome all our speakers, esteemed guests, as well as the delegates. Over to Dr. Vasant Kumar. Dr. Vasant Kumar.
Thank you, Dr. Bansi Sabu.
Sure.
It's a proud privilege for me. Are you able to hear?
Dr. Vasant Kumar, connectivity is lost. Yes, Dr. Vasant Kumar, I think your connectivity is poor.
Yeah, good evening. I was actually okay until now. Is it still poor?
No, now it's good. Now it's good.
Thank you so much. Good evening, my dear colleagues, doctors, RSSDI members, and Rotarians from across the country. It's actually a great privilege for me to welcome the galaxy of very distinguished people who are with us this evening to inaugurate this wonderful occasion of Defeat Diabetes campaign, which is going to happen tomorrow. And it's actually a great opportunity for all of us that amongst us, today's chief guest is none other than our great spiritual. So my pranams to Ravi Shankar ji. And we always look forward towards his blessings, his guidance, and hoping that we are going to do a wonderful program in future. and we require his blessings always to do more. And amongst the other distinguished guests, we have Andrew Bolton, our own colleague and current president of International Diabetes Federation, who is with us. We all know that he's an extraordinary. I welcome him. And we are very happy that we have Mr. Shankar Mehta, a great leader. He's a world Rotary leader. Currently, he is the president Rotary International, a person who would go to any extent to help the humanity across the globe. And we are so happy that he's with us. Along with that, we have, as I told you, many distinguished guests and colleagues like Dr. K. Srinath Reddy, who has been doing wonderful work for the last many decades. We have Dr. Jailal, who is the leader of IMA, Dr. Shashank, our own friend, who has been doing extraordinary work, especially during this COVID time. And we have two RI directors who are the senior most leaders of Rotary International representing India, that is Dr. Mahesh and Mr. Venkatesh, and I welcome them. We have our own patrons, distinguished seniors, past presidents, Dr. Chandalia, Dr. Das, Dr. V. Mohan, and we have Dr. Anup Mishra, a very well-known senior endocrinologist and a researcher. And we have a host of my own colleagues, the task force members who have done extraordinary work. We have our president, Dr. Bansi Sabu, secretary, Dr. Sanjay. And I must also acknowledge the presence of some of the people who have done some great work along with the task force. That is our founder of B2O, Mr. Gautam, and the members of Pharma, especially the Torrent Pharma. And also let me remember Mr. Bishwajit Ghosh, who is here, who made this possible. And I cannot forget to welcome Dr. Bal Inamdar, who represents Rotary India and who has been working very hard with all of us. So it's a great privilege to have all of you respected and distinguished guests. So I look forward to have an extraordinary evening today. And back to Dr. Bansi Sabu.
Thank you, sir. Thanks, Dr. Prashant Kumar. Now we have Professor A.K. Das. I invite him for a few words. Dr. A.K. Das is a well-known figure in field of diabetes. He's a patron of RSSDI. And can I have his slide also? If for 1 minute, I formally welcome him with bouquet of flower. It's e-flower only nowadays, nothing physically we can give. So Professor A.K. Das, we all know he's a past Dean and Director of JIPMER, and currently he is a Dean of Pondicherry Institute of Medical Science. So over to Professor A.K. Das.
Thank you, Bansi bhai. This words, it matters little if the whole world is sleeping. It matters little if many people in the world are not awakened to the problem of diabetes. But today is a blessed day. Today is a game-changing day. And today holds promise that we can do it, we will do it, we'll defeat diabetes. Dear friends, I have been asked to speak for 2.5 minutes regarding the advocacy in diabetes. My dear friends, the esteemed audience, I will not be taking their names because of lack of time, but I must tell you that advocacy for the right of diabetics, for the persons with diabetes, for the early detection, optimizing or the optimal treatment, screening for the complications, and empowerment for the self-education, self-management is the right of every diabetic. Therefore, the advocacy for diabetes is the most basic thing that we are today pledging ourselves for. Dear friend, it means access to care for all the diabetics, be it in the school setting, be it for a childhood diabetes, which Bansi bhai champions, type 1 diabetics, it may be care of young diabetics, type 2 young diabetics, which we're studying under ICMR. And you know, diabetics in the child care setting, we have to be advocates for them. It also includes the full right for the diabetics, like diabetes and driving. Diabetes having proper employment. I'll give an example of I could not employ a pharmacist, my dear friends, in spite of all my influence in JIPMA. He could not be employed in the Indian Air Force as a pharmacist. Only thing, he had type 2 diabetes. I don't know how it stands to reason, but we have to have that advocacy for the employment of the persons with diabetes in every walk of life. And also diabetes, right, for the person with diabetes in the correctional institutes. I remember what our very dear friend, President PHFI, told in last December 11th. I think you would remember, I think all of you there. I think Andrew was there, Chantal Matthew was there. He said very, very forcefully that access to diabetes care is the right of every man. And he said that the right to insulin, access to insulin, is a right as is the right to light, air, and water. What a strong statement. Dear friends, I will end by saying that today's large-scale screening for diabetes is an effort towards that, to strengthen the advocacy for the diabetes care through timely detection and bringing awareness across the globe, especially, particularly in the India and in the Asia. Dear friend, let us all join hands for this advocacy for the diabetics. I will take it one step further. Me, Bansi Bhai, and few others are also very passionate to say we want to be advocate for the early action for diabetes. And we had two meetings to discuss about it. Early action to detect, early action to provide access to care, early action to screen for the complication, early action to treatment, and early action to prevent diabetes. Thank you very much for giving this opportunity.
Thank you, sir. Thank you. Now I request Professor Dr. H.B. Chandalia, sir. Dr. H.B. Chandalia, sir, is one of the senior most member of RSSDI. He's a patron of RSSDI, and Professor H.B. Chandalia is Director of Denmark Institute of Diabetes and Endocrinology based at Mumbai. He's a professor also. He has long back, before almost 20 or 30 years before, he has a Defeat Diabetes Trust was made by him. So I would like to ask Dr. H.B. Chandalia, as the RSSDI is an organization of 50 years, and he must be members of RSSDI since last 40 years at least. So he'll be talking from the RSSDI inception to Defeat Diabetes. Over to Professor H.B. Chandalia.
Thank you, Dr. Bansi. I think we started this Help Defeat Diabetes years ago. And the President Bansi and finance this movement. This movement is very important, and now we are in the presence of two very important personalities besides all our colleagues here. Is the spiritual leader like Sri Ravi Shankar, and of course the Rotarian leaders. And I have something else to say besides, of course, this wonderful program that is being conducted under the aegis of RSSDI. And there are two things which I want to touch upon in a couple of minutes. One is that we really seek help of leaders like spiritual leaders, Rotarians, social workers. Because a couple of weeks ago, during the Defeat Diabetes program, only Dr. Bansi had invited me to speak. And my topic was the interaction of modern science with the modern medicine with Indian culture. And this interaction is not a very good one. See, even now we don't have a scientific attitude. Our people don't receive modern medicine in the right perspective. They are still enamored by old systems, which also have some place, according to me. I'm trying to really place Ayurveda or even those remedies. Some of us know quite a bit about those remedies, and we think they can help very mild early type 2 diabetics. So we want to give a legitimate place. But beyond that, I think to take help of those systems where people suffer in this country. And I think if some scientific attitude can be created, and I must say that making opinion and seeking adherence, there is nothing like religious leader. To my mind, they're the most powerful people. So I have to really, and the people who are Rotarian movement, I've also been a Rotarian, so I know it's a big movement. So I think they can influence people's thought processes much more than any of us here from RSSDI. Once in a while, I thought that maybe if we all wore, instead of wearing these fancy Western clothes, we wore probably saffron clothes, we may be able to do the same, but it doesn't look like we can do anything near to what they can do. And therefore, I have to request them to really make some change in our culture and thought processes, where patients seek help, they take help, they adhere to programs, and we get good results. And this is something which we scientists are unable to do. So we really seek your help, and I'm very, very happy that we have brought them today here with us, and we seek their blessings and we seek their advice how we can influence people's mind and thought processes, which are coming in our way of rendering good services to diabetes. So thank you very much, all of you, and I'm very happy to be part of this movement, Bansi. Once in a while, whenever you seek my help, I'm there. It's a wonderful movement for the patients to really join and also galvanize it further. Thank you very much.
Thank you, sir. Thank you for your blessings. Now I request Professor Dr. Anup Mishra. Anup Mishra is a senior diabetologist, endocrinologist. He is a chairman of CDOG. Professor Anup Mishra actually written the article that glucose monitoring should be considered as a fifth vital sign. And he included me, Dr. Jyoti Dev, Dr. Arvind, and it was because of that article, rather, one of the reasons why we are here for this Defeat Diabetes campaign. And he talked as that glucose monitoring should be considered as a fifth vital sign, the way we are measuring the temperature, pulse, blood pressure, respiratory rate, or oxygen saturation. So we want to know more from Dr. Anup Mishra about the glucose as a fifth vital sign. Over to Professor Anup Mishra.
Thank you, Bansi. Thanks for inviting me. I really admire the efforts that you, Sanjay, Vasant, Amit, and the whole team, Purvi included, everybody is making. And I'm just a sort of innocent bystander, just admiring your efforts time and again. You've taken so much of so many initiatives. Coming to the paper, yes, it was I retrospectively think it was a good idea to write that paper. And of course, take opinion from all of you. We had a lot of appreciative remarks after that paper and some resistance also. We wrote that the blood glucose should be measured in any patient who's entering the hospital, whether this patient is diabetic or non-diabetic. And then subsequently, during the hospital stay also, multiple glucose measurements have to be made, again, whether the patient is diabetic or non-diabetic. And we give a lot of data, a lot of background to this and a lot of scientific data. And we proved a case that blood glucose is one of the strongest determinants of morbidity and mortality, even in non-diabetic people. And that one blood glucose determination never is sufficient, and that multiple measurements are necessary, and the control of the blood glucose for both types of patients are necessary, and especially in those who are in ICU, and it is well proven now with the COVID-19 that even a small elevation of blood sugar actually leads to lots of morbidity and mortality. And somebody asked us, somebody wrote a letter to editor and said that while you say that blood glucose should be the fifth vital sign, other vital signs can be measured with hand or with a stethoscope or with a blood pressure or with a temperature, with a thermometer. And while you need an invasive device, I wrote there that today it is an invasive device, tomorrow it will be not. And that there are many devices, including the watches which are coming, which will non-invasively give you the blood glucose. So I think we are a little ahead of time, but we are looking at this, and this should be the vital sign. And this is how we started the campaign, and Bansi was very kind enough to support it. I think this notion should be disseminated to all physicians and our colleagues, not us, our colleagues who are surgeons, who are gynecologists, who are pediatricians, who are in other specialties, that they should include this in their repertoire of tests and continue measuring if the patient is seriously sick. So once again, I really admire the initiatives that you have taken, Bansi. I'm just a theoretician. You are a practical person, and you are the actually who does the things. I just theoretically write. I'm good at writing, so I write, and you're so good at doing things. So congratulations to you and your team. Thank you.
Thank you, sir. Thanks for all
You-
your. Yes. So before Amit, Dr. Anup Mishra, I just wanted to tell that the fifth vital sign we have taken as a place also, and more than 100,000 physicians. And with the help of IMA, it has reached to almost 300,000 physicians. Just to consider that we should understand the sugar as a monitoring as a fifth vital sign. And more than 10,000 doctors already signed the petition also for the same. So now over to Dr. Amit.
Thank you, sir. As rightly said by Dr. Anup Mishra, sir, that today we might be ahead of time, but very soon in the future, it will be accepted as a fifth vital sign. Now, I would take this opportunity to invite Mr. A.S. Venkatesh, who is one of the international directors of the Rotary India. He is an alumni of IIT Madras and IIM Ahmedabad, and he is heading the Rotary, and he is a global leader. So I would like to invite Mr. A.S. Venkatesh, and I would request him to talk about the community health initiatives which Rotary has contributed for more than the last 100 years. Do we have Mr. Venkatesh there? Yes, Mr. A.S. Venkatesh is there, but his camera is switched off. Mr. Venkatesh, are you there? So let's wait for him to come. Now I would request Dr. Bal Inamdar is here. Then I will request Dr. Bal Inamdar. Dr. Bal Inamdar is heading the medical projects of the Rotary in India. He is the project advisor, national project advisor. And for last 1 month, he is working tirelessly to make this One Nation, One Day Million Test campaign to turn it into a success. He has really played a very, very big role in planning all the logistics and bringing all the Rotary clubs together. Let me just inform you that today we have more than 4,000 Rotary sites which are registered for this campaign, and more than 2,000 Rotary clubs which are there. So I will just request Dr. Balkrishna Inamdar. Sir, please, you are most welcome, and please go ahead with your speech.
Thank you, Amit. President Bansi, respected seniors in RSSDI, RI Director Venkatesh, we call him very fondly as Venki. I can see Biswajit and Hiralal also on the call. And so many of you who have been such outstanding workers, outstanding go-getters, if I were to say so, for this particular campaign. Let me start by congratulating RSSDI for thinking of this campaign. I think if we are talking about 57% undiagnosed in the population, then this is a campaign which is very, very crucial to diagnose those who do not know that they're diabetes. And you have thought of it. 1 million a day is just a start, but I'm sure it will carry on. The fallout of this will be for so many months and so many years in the future. And Rotary will be with you for next few years. If we have already signed a MOU for 3 years, and let me once again congratulate you, because I think you have done a great work by envisioning something which not many would have envisioned. For us, this was something which was a new thing. In a diverse continent, diverse nation like ours, it is very difficult to see that all Rotary clubs in a single day will work for a single cause. We have seen for a single cause, numerous Rotary clubs working over a period of months and years, but on a single day, single cause, first time we have done. We have seen this. It has this journey has been sort of a self-enlightening journey for me, self-enlightening. not only for Rotarians. We never thought that Rotarians will come together. We initially thought that about 2.5 lakhs strips will be utilized by Rotary. But then when actually the figure came, it turned out to be 1 million. That is a tremendous amount of drive that we have found. We have found a new Rotary. We have found the strength that Rotary has. We have found the compassion and commitment that Rotary has, which we never thought initially that was possible. This is a new era, new step for us to understand that Rotary is what it is. And I have to thank RSSDI for allowing us to know ourselves better. And that itself is a great, great step forward. And I'm very sure that we will not look back after this. And wherever you wish, we will be with you. You know, I always said one thing, that unless you reach the limits of possibilities, you don't know that you are already in the realms of impossibilities. And this is exactly what we have found out, that we try to reach the limits of our possibilities. And suddenly we found that impossible of 1 million for a single organization is possible. Then we have to curtail, that's a different issue. Logistics is an issue, undoubtedly, but that we will take care of that. All of us together will take care of that. And I wish this campaign a great, great success. Let this be the first step in a campaign for years together. Let's defeat diabetes. Instead of being a capital of diabetes, let India be a zero diabetes nation. Thank you so much for inviting me. It's a pleasure for me to be here.
Thank you, Dr. Bali Damdar sir, for rightly pointing out that we should be challenging our limits. And this is what Gurudev Shri Ravi Shankar teaches us, that we should always be challenging our limits. And this is what RSSDI does and the Rotary India does. And now I would request Dr. A.S. Venkatesh, that Dr. A.S. Venkatesh, please switch on your camera, and we would love to hear from you. You are muted, sir.
Thank you, Dr. Gupta. It's as Bal was mentioning a while ago, this is an unimaginable kind of response that we have seen. Bal has been keeping me in the loop about the number of clubs that were joining in and the number of registrations, etc. And once I even asked him, have you added a 0 or 2? That is the kind of numbers he was coming up with. I'm really pleasantly surprised, I would say, to see the kind of response we have got. And it also reinforces our belief that given a good cause, everybody will rally behind them. All it needs is a good cause and a good reason to be together, and everybody will rally behind. So in that sense, this is one of the most meaningful initiatives, and I should thank and congratulate Stop Diabetes Society, Defeat Diabetes Society for thinking of this and inviting Rotary to join as a partner. That's an honor to all Rotarians. And I've had several calls, though I have had no active role in organizing this, except to be invited because I'm the Rotary International Director. But Bal has been doing a lot of work on this. Of course, Dr. Vasant Kumar, I don't know which hat he wears now. He wears different hats, and he has been a crucial link for all our activities. I'm sure this is just the beginning of what we can do together. We have the reach, you have the intent, and together we can create magic. So this is just the beginning, and I hope that this association will go a long way to ensure that, as Bal was saying, it's optimistic and utopian idea that there should be no diabetic case in India. If that can be reached, I think that's the best we can ever do. Or even if we can get close to that, I think that's really wonderful. Thank you for having Rotary on board, and good luck to everyone who is a part of this. Thank you.
Thank you, Dr. Venkatesh, for your words. I would request Mr. Vishwajit, do we have our International President of Rotary, Mr. Shankar Mehta here?
So, Dr. Amit, Mr. Mehta is just finishing a call and he'll join in 2 minutes. I'll notify you soonest.
I will request Bansi.
We have Rotary International Director, Mahesh.
Yes.
Want him to speak first?
We can request Dr. Mahesh Kotbadi.
Dr. Mahesh Kotbagi, is he here? He has not joined service.
Okay.
Yes. Sir, you can proceed to request Dr. Sanjay Agarwal.
Yes. Yes. So now I request Dr. Sanjay Agarwal, our Dynamic Secretary of RSSDI. Dr. Sanjay Agarwal will talk about the Defeat Diabetes campaign, which we initiated on 1st July. So the concept of defeat diabetes, and then this 1 million test by Dr. Rakesh, who will be talking about the technical aspect of this 1 million test. So over to Dr. Sanjay Agarwal. Sanjay is a senior diabetologist and physician at Pune. He is currently the secretary for RSSDI. Over to Dr. Sanjay.
Thank you very much, Dr. Bansi, and greetings from the RSSDI Secretariat. We've had some wonderful views that have been put forth from the leaders, thought leaders of RSSDI, as well as from the Rotary. And I would really reiterate what everyone just said, that we are really faced with a tough situation when we talk about diabetes, because we know that it is a very important part of non-communicable diseases, which does not get its due importance when it comes to planning care in our country. We know that diabetes involves all ages. It involves both genders equally. It involves all age groups. It involves all organs. And majority of our people cannot afford care when it comes to complications of diabetes. So it's important that we address this problem early. And for that, it is important that we diagnose it early enough before people are faced with all the complications. We know that in our country, statistics show that 8 to 13% of our population have diabetes, and 57% of our people are not even aware that they have diabetes. So this vision of Dr. Bansi was to identify people who are not aware that they have diabetes, to bring them in the mainstream of treatment. And we hope that by this campaign, there will be better awareness about importance of diabetes, the importance of testing for diabetes, and we should have most of our people who are not aware come to the doctors and seek treatment. I think defeat diabetes was a great vision by Dr. Bansi in his presidency. Of course, a lot of data which was put forth by Dr. Anup Mishra, based on which we formulated the whole policy of defeat diabetes. And I think it was an excellent example of the power of collaboration. The collaboration with powerful organizations like Rotary International, pharmaceutical industry, NGOs, Government of India, and most important, the healthcare professionals. And if we can join hands and work together, I think it's a matter of time where we'll change the landscape of diabetes in our country and lose the dubious distinction of being leaders of diabetes population in the entire world. So with this, I would like to really say that when we started the campaign, the numbers that we thought about seemed to be very unrealistic. And when Dr. Bansi said that we should do 100 million in 100 days, all of us looked at each other and said, can we achieve this? But today, I think we have surpassed our vision. And we have now, as Dr. Bansi told me a little while back, we thought about 100 million, but we have surpassed that. And I think we're close to about 130 or 140 million that we've already seen. And it was just a matter of pride that we said that we should do 1 million testing in one single day to prove the world that we are capable of doing great work. And I think we're going to achieve that and possibly go beyond it. So I'd like to thank all stakeholders, the leaders of RSSDI, the members of RSSDI, the leaders of Rotary, members of Rotary, and the pharmaceutical industry, the NGOs and the Government of India, who have all come together to support this initiative and make it a grand success. So thank you one and all, and we look forward to future collaborations and see that we can make this importance of diabetes felt at every society level, and hope that we can beat diabetes for the future. Thank you very much.
Thank you, Sanjay. Now I invite Dr. Rakesh Parikh, a technology man of our task force. The task force which we have created, Rakesh is a real technology man. He's a diabetologist based at Jaipur. So first he will talk, Rakesh, that whether we achieved 100 million in last 80 days and what he has chosen, how he had identified that we had reached to 100 million. And then he will be talking about that 1 million test which we are going to do. What's the technology which we are using to confirm to use this world record also. So over to Dr. Rakesh.
Thank you very much, Dr. Bansi sir. And it's actually a proud privilege. I could not imagine to be with the teachers and mentors like Dr. Anup Mishra, Dr. V. Mohan, Dr. Shashank Joshi, Dr. A.K. Das, to be on the same panel. We started with this Defeat Diabetes campaign when Dr. Bansi Sabu broke with us the idea of reaching out to 100 million people. And as Dr. Sanjay said, we were all quite skeptical that this figure looks to be next to impossible. But then I'm very happy to tell you now that with the efforts of the whole team of defeat diabetes, we had 100 ambassadors. We had to extend the number to 250. The group limit was reached, and then we had to form another group. And now we have thousands of doctors who are working daily on social media for creating awareness of diabetes. The analysis that we have is suggesting that just by tracking for defeat diabetes as a hashtag, we have reached 123 million people in just 80 days. The target was to reach 100 million in 100 days. And this is not including our reach to people through WhatsApp, through FM, through media, through Facebook Live, and through community reach. There are so many other things. So I would say we might have probably reached 500 million if we count all these things in. Secondly, when we broke this idea of doing a camp like this, 1 million people, just the idea was to just do a huge camp so that we can get some attention and probably create awareness through that. Dr. Bansi said that let's do 10 million. Again, we were shocked. 10 million is a huge number. So my sentiments would completely agree with what Dr. Inamdar said. We probably were like Hanuman. We didn't know what the power of our organization is. So now I feel that, just as you said, that Rotary can do a lot of things. Probably RSSDI can do so many wonders if we come together. So now we were targeting for something around 5,000 sites. We have around 10,000 sites, and we had to stop registration. And I must compliment Rotary for that, because Rotary had the maximum sites. Amit was always worried that how can we handle so many sites. We had the issues of logistics, supplying so many strips, so many meters. Fortunately, Gautam was with us to support us in that. Pharma industry was with us to support on that. This was the first experiment, and I am speechless about the emotions that I have, that we are tomorrow probably going to make a world record, which might be very difficult for anybody else to break. We will be doing 1 million blood sugar tests in one day for the first time in the world. To conclude, I would thank the leadership of Dr. Bansi Sabu, who is a visionary, who inspires us that nothing is impossible. Just think big. So 100 million, 10 million were things which we could never imagine of. Dr. Vasant Kumar, Dr. Sanjay Agrawal, Dr. Sunil Gupta, then our patrons like Dr. Anup Mishra, Dr. V. Mohan, Dr. Shashank Joshi, Dr. A.K. Das, who have always inspired us. The whole team of RSSDI, all the ground workers who are right now tweeting about this event. Rotary, which is an indispensable part. We couldn't do this without Rotary. The sponsors like Mr. Gautam, Beat.O, and the other pharma industry. I might forget some names, but without their support, we probably couldn't do this. But then I would just say thank you all. Thank you, sir.
Thank you.
Dr. Bansi and Dr. Amit Gupta, our President, Mr. Shankar Mehta has just joined us.
Yes, Amit is going to introduce. Amit.
Thank you, Dr. Rakesh, for your emotional words. And we really appreciate that you are the man behind who have created all the technology, which we are going to test tomorrow. And now it is our proud privilege to invite Mr. Shankar Mehta, who is the president of Rotary International. Let me just tell you, Rotary is a 115-year-old society, and it is a matter of pride for each and every Indian that he happens to be the only fourth person from India who has become the president of Rotary International. So he is a truly global leader, a man who inspires lakhs of people all across the globe. With these words, sir, I would request you to please come and say a few words and deliver your guest of honor speech, sir.
Thank you so much. I'm so happy to be a part of this wonderful event. I've been listening to the various achievements, and I feel very proud that Rotary has been associated with this wonderful work. Disease prevention is one of the focus areas of Rotary. We believe strongly that prevention is better than cure, and it's always better that we take care of the health of people. And that is one of the reasons why we had taken up the program of polio eradication. That has been our mainstay, and we take great pride in the fact that the only second vaccine preventable disease to be eradicated is now very close. We are just this close for the last 8 months.
the last two countries, Afghanistan, Pakistan, have not had a polio case. Another 4 months and hopefully we would have seen the end of it. So fighting disease, working for it is absolutely a passion for Rotarians, and not just in India, but across the world. 1.2 million people for 35 years have had a single goal of eradicating polio. I'm so happy that we are now wanting to defeat diabetes. What a wonderful day tomorrow is going to be, when we're going to create a record of 1 nation, 1 day, 1 million tests. Wow, I love that slogan. And I must compliment each and every one who's involved with this program. Dr. Bansi Sabu, Mr. Rakesh Parekh, Dr. Amit Gupta, Dr. Sanjay Agarwal, and our own Dr. Bal Inamdar, all the people who are involved with it. Absolutely, my compliments to each and every one who's been involved with it. Rotary feels privileged and very happy that we are able to participate and make an impact here. Non-communicable disease is, of course, such an important aspect. People need to understand the lifestyle. The living style needs to be improved. Also, India happens to be the world capital of diabetes, and it's so very important that we bring it to the notice of people. And these events like this, doing on 1 day, it catches the imagination of people. It reaches out to people. And I think that is the purpose, where people suddenly are talking, everyone's talking, the hashtag is there. Young people come to know of this thing. Oh, wow, 1 million in a day. Whether 1 million in a day is important or not, but the message that it is about diabetes, that is more important. People then understand that it is very important. Let's start thinking about diabetes. It's important that we care for ourselves and live a healthy life. So my compliments to each and every one of you who's participated. I'm not naming individuals, but great work being done on behalf of Rotary. We are very happy once again to participate in it. All the very best. And tomorrow, let's keep our fingers crossed. World record to hona hi hai tomorrow. Thank you.
Thank you, sir.
Thank you.
Bansi sir to take it.
Yes. Thank you, Amit. And thanks our International President, Dr. Shankar Mehta, for gracing the occasion. Now I request world famous, our own patron of RSSDI, Dr. V. Mohan. He is a great researcher. Dr. V. Mohan initiated the campaign that let us do Bansi monitoring, and monitoring is very, very important. And he initiated in month of May and June, and then we all took it up. And we started talking that monitoring is very, very important in diabetes. So all of us, we know Dr. V. Mohan. Just to introduce, he is a chairman and diabetologist of Dr. V. Mohan's Diabetes Center and Academy based at Chennai. And he's a currently patron of RSSDI. He's a past president of RSSDI and very senior member of RSSDI. Over to Dr. V. Mohan for his few words. Thank you, sir.
Thank you, Dr. Bansi. I'm overwhelmed. The last 45 minutes I've been listening to various people speak, and thank you, first of all, for inviting me to be part of this. My heartfelt, my heartiest congratulations to you, to Dr. Vasant Kumar, Dr. Sanjay Agarwal, Dr. Rakesh Parekh, and all those who are involved in this movement. I would like to call it as a movement. Any movement to be successful needs active collaboration. And here I see the collaboration of not just RSSDI, but spiritual leaders. And it's very nice of Sri Ravi Shankar to extend his support to this, from help from people like him. As was mentioned earlier, will take this message far and wide, not just in India, but across the borders as well. And having an international organization like Rotary to support us also brings in, because then you're extending your reach so much more. And then, of course, RSSDI is the second largest diabetes association in the world, only second to the American Diabetes Association. And we're fast catching up. And we have been always talking to Bansi that we should now exceed, given the population that we're 3 times as big as the US, and we have probably 3 times the number of people with diabetes in India, we should be the largest diabetic association in the world. And the day is not far when RSSDI will become the world's largest diabetes body. And then we also have the participation of industry and many partners like Beto and others are also here. So all these people coming together, NGOs and RSSD, and also getting the support of the government to do all this, I think is very, very important if we have to take this message forward. What better occasion to launch a campaign like 1 million tests and so on, other than World Heart Day? And we have Dr. Srinath Reddy here, who was the president of the World Heart Federation. And I would like to, give a slightly different thing going forward. 57-58% of our people remain undiagnosed. So picking up all those people is extremely important. And this is the first important step of identifying these people. So we should not have a single person with diabetes who is not diagnosed in our country. And that is where, as was spoken by many others, these kind of campaigns will help to spread the message that you can have a disease and not know about it. And therefore, it's our bounden duty to pick up those people. Otherwise, they'll develop complications and only then come to know about it. But on that note, I would like to say that the ultimate aim of treatment of diabetes is to prevent the complications of diabetes, whether it's a macrovascular complications like heart disease, which will be talked about a lot tomorrow. You're going to hear a lot about heart disease, and diabetes is considered as a cardiovascular risk equivalent. That means the moment you get diabetes, almost as if you already had a heart attack. So whether it's macrovascular disease, including strokes, peripheral vascular disease, and coronary artery disease, and also now heart failure is coming in, but also the microvascular complications affecting the eye, the kidney, the heart, and the feet. Now, whether we will be able to completely eliminate diabetes, I'm not sure, because diabetes was there even 5,000 years ago or even before. And it will probably increase because with the increasing lifespan, diabetes is also going to increase because we have two non-modifiable risk factors. One is family history of diabetes and the other is aging. And these two we cannot prevent. So diabetes will be there. But why not we plan for a diabetes complications-free India to start with? And India can take the lead in this. And then ultimately have a diabetes complications-free world, which means there may be millions of people with diabetes, but not a single person will get a heart attack due to diabetes, or lose their limbs, or go blind, or have kidney failure. And this is where I think all our efforts should go. First, identify the people with diabetes, and truly defeating diabetes would mean that we prevent the complications of diabetes, and thereby nobody will have complications of diabetes. If 10 years from now, if we're able to achieve that and say, our retinopathy rates are going down, our kidney nephropathy rate, diabetic kidney rates are going down, amputations have already gone down. We hardly have any amputations today. Like ketoacidosis has gone down. So like that, can we get all the other complications down? And ultimately, we're able to say that due to diabetes, nobody will get a heart attack. That we'll take care of. You may get it due to some other cause, congenital cause or something else. But due to diabetes, nobody will get that. If we are able to achieve that, and I think this is the first step that we are taking, the first baby step that we are taking, but this can evolve into snowball into something very big, whereby the ultimate goal is to make everybody with diabetes live up to 100 years of age. Although this may sound like rhetoric, many of you will know that last year we published this paper of 325 people who have crossed 90 years of age. They finished 50, 60 years of diabetes and they're still alive. 4 of my patients have now actually crossed 100 years and they've finished more than 50 years of diabetes. So it's beginning to become a reality. But let us think of a day in India when everybody can hope to live to 100 years of age. And not only that, ultimately people should say, I wish I had little diabetes. I would also live up to 100 years of age. And therefore, we just follow the ABCD mantra of getting the A1C down. B stands for blood pressure, get that down. C stands for cholesterol, if you bring that down, especially the LDL. And the D stands for discipline, under which we bundle the diet, exercise, stress reduction, no smoking, moderation, alcohol, and yoga and pranayama. And of course, the holistic healing, which Dr. Chandalia also mentioned, with spiritual gurus like Sri Ravi Shankar can bring to us. So if you bundle all this in, it doesn't look very complicated at all to me. And if you can just put this package together, and RSSDI is the right body to do it, I'm sure we'll make a huge dent in the complications that Indians can have due to diabetes. And the day is not far off when we can definitely dream of a complications-free diabetes complication-free India. And Bansi and to all colleagues of mine in RSSDI, all the very best. I'm really proud of you for the great work that you have done. I think this is unparalleled in history, and I salute you. Hats off to you. Thank you very much.
Thank you, Dr. Mohan sir. And with your blessings and guidance, and with all the stalwarts present here, I am sure what you have just described, it would become a reality someday. And now it's time to invite Dr. Bansi Sabu. And I have been given a very tough task of introducing him. So we welcome you. Dr. Bansi Sabu is currently the president of the RSSDI. And to us, he is I don't have words to describe him actually. He is a leader, global leader. He's a visionary. He has so much in his mind, and actually he dares to dream. And not only he dares to dream, he dares to achieve, and finally he achieves them also. So when we started this project, everybody has a question in the mind that we are doing it all the social media and campaigning. So how we are going to hit the rural India, and how we are going to reach the rural India. So I would request our President, Dr. Bansi Sabu sir, to throw some light on the vision of the RSSDI to reach the rural population.
Thank you, Amit. Reaching rural India was really a difficult task. We know that our 9,000 members, out of them 75% of these members are actually from a tier 1 or tier 2 city. And many of them at the district level, we were not having even our RSSDI member. So first thing what we have done before 1.5 years, we started that we should have a district coordinator across the country. We have 745 districts in our country. And within 1.5 years now, we have more than 650 doctors who are representing our district. And now we have a district coordinator who is directly in touch with RSSDI headquarters. At the same time, he's also with executive committee of state chapter. The state chapter was started in RSSDI in 2007. And then slowly now we have across the country. And before a few days only, we made RSSDI Goa, which is 22nd chapter of RSSDI. Now, next level, what we can do at the district coordinator, we have already more than 600, and I'm sure within few days only, we will be having 747 districts, which all will be represented by RSSDI. And we don't have the members at all these places. So we are going to make the member, and we will be having RSSDI district coordinator across the country by this year and or before that also. But now next we are now coming to the taluka representative. Now each district is having 10 or 12 taluka or tehsil which are there in the district. And we want from each and every taluka or tehsil, we should have a representative also. A taluka representative, he may not be the RSSDI member, but he should be a IMA member, that is definitely. And in future, we would like to make him also the RSSDI member. That's our vision. We have communicated with some of the industry partner to make taluka representative across the country. We have 10,000 taluka representative. Before 3 years, we were having a vision that let us go to village. And we have opened first diabetes clinic in my village, that is Kuchaman city in Rajasthan. And that's what we have started a education program, awareness program, detection program, diabetes detection program, and diabetes complication screening program in that village. And then followed by in UP also few more villages were adopted by RSSDI, few more in Telangana and Andhra. So across the country, few villages we could adopt, but we could not do like 10,000 or 20,000 villages. So our next vision is now to adopt 10 or 20,000 villages in India with the help of these taluka representatives. Already we have started work on it at the ground level. Now we know that how many tehsils and taluka are there in India. We know that we could identify who are the IMA members in these taluka and tehsils. We are writing them that would they like to become the part of this national movement? Will they become the member of RSSDI? Would they like to become a taluka representative? And what we can do with that? We want to first teach them about our RSSDI guideline, our national guideline. They should know how diabetes to be treated. They should know the basics of diabetes, basic screening of the diabetes patients, and basic screening of the diabetes complication. That is what our vision is. In next 2 or 3 years, we will be having across the country a taluka representative. And as Dr. Vivan was talking, that we should become the largest organization in the world if we can have these taluka representative and all the districts from where these doctors are not becoming the members. If we will make them member, probably in next 3 years, your vision of RSSDI is one of the biggest organization. It will become biggest organization on this earth. That is what our vision is. So with this view and with this vision, we are moving ahead, and probably in next 2 to 3 years, we will have across the country taluka representative or tehsil representative. This is what we are going to do. At present, at district coordinator, we are already teaching them not only about the RSSDI guideline, but our type fund, which is also a very neglected problem and neglected most of the time. Type 1 diabetes are delayed diagnosed, they die early, they are not screened for the complication, they are not getting the treatment properly. So we have created a type 1 diabetes network, and we are also reaching to these district coordinators. And the second big problem is diabetic foot, which is a very neglected complications. And in rural area, again, we don't have the expert. And with the task force of D-foot, which is diabetes foot problem, we are reaching to these district coordinator and we are educating. We have already on 16th and 17th a national program only to teach these district coordinator for 2 days on RSSDI guideline and type 1 diabetes as well as for diabetes foot before our 15 days of our conference. That is what our plan is. With these few words, again, blessings from all seniors, and thank you for all joining and giving me blessings, and to the RSSDI and to all RSSDI members for this Defeat Diabetes campaign and for this 1 million test which we are going to do. Thank you. Thank you, Amit.
Thank you, Dr. Bansi, sir. Now I would like to invite Dr. Shashank Joshi, who is the chair of IDF Southeast Asia. And sir is our mentor. He is past president of RSSDI, past president of API, past president of Endocrine Society of India. And there are so many, he is enrolled in so many clinical trials, studies, and he is also the task force member for the COVID in Maharashtra. We welcome you, sir, and we would like to hear you for this One Nation, One Day, 1 Million Test events.
So, Namaskaram, brothers and sisters. Thank you for having me here. It was exactly 10 years back that I was president of RSSDI. And Bansi, I'm very proud of you. You make India proud, and your whole team, Amit, Rakesh, Purvi, and everybody. I may forget everybody here. And of course, you have a very able incoming president in Vasant Kumar. You have a very capable secretary in Sanjay. We have all our mentors here. And of course, our teachers here like Dr. Mohan, Dr. Mishra, they're all here. And the Rotary has joined us, partnered with us. We have mentor here, Dr. K. Srinath Reddy. He's been the world leader in various fora, particularly in cardiometabolic and non-communicable disease. And therefore, it is really worthwhile that what you're doing. As we all know that, every 11th human being on planet Earth who walks, male or female, has diabetes. And if the same, we are 1/7 of the world in India. And in India, in urban India, when, out of 10 people, if they're walking in urban India like Mumbai or Delhi, 5 of them are having diabetes. And out of those 5, probably only 1 or 2 know that they have diabetes. And if you're going to rural India, that figure may be 1 in 8, 1 in 9, or something like that. So obviously, there is a lot of invisible disease. And what you are attempting by this campaign is unmasking the invisible disease, particularly on the day, which is the number 1 killer on planet Earth, which is heart disease. Even today, Dr. Reddy will correct me, almost 18 million people die due to heart disease, and it's the single most and the largest killer on planet Earth. Of course, COVID has been competing with everything. And it's unfortunate that even when we talk today on the 28th of September 2021, every 7 seconds, 1 diabetic is dying. And 80% of the deaths in diabetes are due to heart disease. So obviously, I think your commitment in diabetes advocacy and awareness, Bansi, and the whole entire team of RSSDI is commendable. You want to unmask that invisible hidden disease in the population, which is why you have taken this record-breaking journey. I wish many such days more, and you have such a wonderful future India team leaders in Amit, Rakesh, Purvi, and Nandita. I can see her, and so many others, Anjana, and Sunil is of course there, Sanjay is there, I can see Srinivas Murthy there, and all of them. And of course, you have very woefully and very, very nicely partnered with all stakeholders. So I think it is very, very commendable, Bansi, that you are being leading this from the front. And I hope that you continue this movement. Fortunately, we are not the world number 1 in diabetes now, we are world number 2. We should aim to be the diabetes care capital of the world and diabetes prevention capital of the world. And I think when we are talking of diabetes prevention capital of the world, we should aim at a diabetes-free India. Diabetes Mukt Bharat. And that should be really our goal. And Dr. Mohan did make a passing mention, Om Sai Ram sir, that it should be complication Mukt Bharat, but we should be ambitious. We start with diabetes Mukt Bharat, eventually leads to a diabetes Mukt Bharat. And it's possible. It's all in our lifestyle. It's all in our mindset. It's all about eating less. It's all about eating slowly. It's all about eating on time. It's all about doing physical activity, whether it's yoga, pranayam. It's all about sleeping on time. And the main thing probably which has afflicted all of us is, we are digitally intoxicated, whether we are seeing through the Zoom or whether we are on our smartphone and whether we are restless because of time challenges. I think it's important that, we should do digital detox for 2 hours every day. I think we have got over digitalized. And I'm certain that with leaders like Dr. Reddy, they will have a guidance soon. And I'm certain RSSDI should be the first society to pass a guidance in India that we should do 2 hours of digital detox every day. Because it's very important for maintaining sanity of human beings. Because mental health is as important. I'm very happy that you have called spiritual leaders like Gurudev, Shri Ravi, Shankar ji. And I'm certain that when you're looking at happiness and health, an important thing is not to get cluttered by, messages which make us uncertain and restless. And that's really the truth. So my best wishes to all of you. Thank you for having me here. And once again, congratulations, Bansi and your entire team. If I have inadvertently forgotten anyone, my apologies. Jai Hind, and let's wish for a diabetes or Madhumeha Mukta Bharat. Thank you.
Thank you, sir. Now I would like to invite one of the most senior doctor here, Dr.
Dr.
K. Srinath Reddy. I would like to invite Dr. K. Srinath Reddy. And sir is the president of Public Health Foundation of the India. And sir, we will seek your blessings for this ambitious project, which looked very difficult in the beginning, but with the blessings of Gurudev Shri Ravi Shankar and the support of the Rotary India and all the other stakeholders, we are going to attempt it tomorrow. So I would request you to, sir, kindly deliver your address.
First of all, let me say how grateful I am for being invited to this event, for being inspired by the wonderful initiative that you have taken and so extraordinarily well organized in terms of the campaign that you're conducting tomorrow, as well as being inducted into this very eminent group of people who have been leaders in the field, not only of diabetes, but also of clinical medicine and public health. Indeed, it is with the greatest sense of both gratitude and appreciation that I'd like to congratulate you on the excellent campaign that's being organized in terms of ensuring that 1 million people get tested for diabetes tomorrow in India. I'm gratified that you're doing it on the World Heart Day. As a former president of the World Heart Federation, it is particularly something that is most gratifying to me. But I recognize that the link between diabetes and cardiovascular disease is so integral and intricate that this alliance is not only natural in terms of clinical management, but also in terms of public health action. And therefore, this fits in very well with the theme of the World Heart Day. If you're really looking at how even diabetes and blood pressure are linked, leave aside other elements like coronary heart disease and cerebrovascular disease, it is very clear that for quite a few years we have recognized that diabetes is actually so closely linked to hypertension. Hypertension has been regarded as a pre-diabetic state in which it can actually be a predictor of future diabetes. But equally importantly, the management of hypertension must take into consideration whether there is a coexistent diabetes. Recently, over the last 1 year, I've had an opportunity, 1.5 years actually,
just started before COVID, but then concluded about 2 months back. I had the opportunity to chair the WHO guidelines group on pharmacological treatment for hypertension. And in that process, we had an opportunity to extensively review published evidence. And it was absolutely clear that we needed a lower threshold for deciding what should be the recommended blood pressure goal for pharmacological treatment of hypertension in persons with diabetes. This is not anything new, but because this is a global guideline, particularly relevant to health systems of low and middle income countries, the point needed to be reiterated that the systolic blood pressure goal that needs to be aimed at is less than 130, probably even lower the better, but certainly lower than 130. So the relationship of diabetes and hypertension is so abundantly clear in terms of mutually reinforcing risks that they need to be really looked at integrally. And that cannot happen unless there is an opportunity to detect diabetes early enough. We also recognize this during the course of the COVID pandemic. World over, it's been recognized that diabetes has been one of the major predictors of increased risk in COVID, both for severe disease requiring hospitalization and intensive care, and unfortunately as well. And therefore, neglect of diabetes by way of not detecting and not treating adequately would be a cardinal error, even when we are looking at how infectious disease epidemics must be managed. And that was true, whether it was H1N1 or H5N1 or SARS-1, always the advisories that were put up said persons with diabetes are at higher risk. But then, how do health systems actually manage to detect people with diabetes who are likely to be at higher risk? Even when vaccination policies were enunciated in India, for example, the first recommendation was persons above 60 years without necessarily having to produce evidence of comorbidities. Persons above the age of 45 years would have to produce evidence of comorbidities. And then the rules changed and said above 45, everybody can take it. But between 18 and 45, you had to have evidence of comorbidities. And then, of course, now it says anybody above 18 years. But one of the reasons why these rules had to be relaxed very clearly, even before adequate number of vaccines were available, is the recognition that asking for demanding evidence of comorbidities like hypertension and diabetes is something impractical in a country where health systems have not managed to efficiently detect the presence of diabetes and hypertension in a large number of people, particularly in small towns and villages. So we were depriving people of the opportunity to get vaccination when we asked for medical evidence. So it is the unfortunate underperformance of our health systems which actually revealed these weaknesses. And while we might actually now give everybody vaccine above 18 years, it also is incumbent upon us to ensure that people who are at a higher risk because of comorbidities like diabetes and hypertension are indeed detected and managed very well. And therefore, the whole idea of public health approach and the health systems approach is prevent as much as you can, but certainly detect early and manage as efficiently as you must. And therefore, I would believe that it is not just defeat diabetes, which I very much welcome, but detect and defeat diabetes. And that is where your whole screening program of detecting large number of people who would have otherwise been undetected becomes extremely important. And I fully agree with Dr. Mohan when he says that we cannot prevent diabetes in everybody. We have to accept the reality that while we must indeed try and prevent diabetes or delay the onset of diabetes, one of the biggest goals must be to ensure that people can lead productive lives without complications of diabetes. So I would say there are two objectives that we must aim for. One is a diabetes-free life as much as possible, but otherwise next would be healthy life with diabetes. And these are the two areas that we must work on jointly, because there is no reason why a person who has developed diabetes cannot have a full and productive life We have enough number of presidents and prime ministers and chief ministers to prove that. And we have so many other people, including athletes as well. So we must ensure that people who have diabetes will have the opportunity to have productive lives, irrespective of the socioeconomic class or the geography they belong to. I entirely agree with Dr. Anup Mishra that it is indeed the fifth vital sign. Because if there are so many conditions which are aggravated, exacerbated, or unmasked by diabetes, then we must certainly detect it. We recognize that it is a major predictor of inflammation, therefore it keeps company with inflammation, which in turn affects so many other disease conditions. And I mentioned when pressure treatment, unless we try and make a conscious effort to find out whether the person is diabetic or not, we'll be failing in our duty. And therefore, attempt to evaluate and diagnose the presence of diabetes is going to be a very important element indeed. But I would say what is essential is to look at it in the context, A, of public health, but particularly in the context of universal health coverage. Because the right to get the health condition attended to by way of health promotion, preventive measures, but also diagnostic measures and effective, cost-effective therapeutic measures is going to be absolutely important. And therefore, let us all try and utilize the platform of universal health coverage and Ayushman Bharat in India in order to project how we must actually tackle diabetes along with several other conditions which are threatening humans in terms of diminishing their life expectancy or diminishing their capabilities to have a productive life. And therefore, it's with greatest pleasure that I would like to support, endorse, and champion this cause that has been so very well taken up and is being so ably led by RSSDI. And thanks once again for bringing me into the picture on such an important event. And I feel truly privileged to be part of this group and part of this campaign. Wish you the very best of success, because in your success lies the success of public health and the success of cardiovascular disease prevention and control, both of which are very important causes to me. Thank you very much.
Thank you, sir. Now I will request our President Dr. Bansi Sabu, sir, to invite IMA President Dr. Jailal.
Professor Dr. A. Jailal is there? Sir? He was there and then we asked him. I think he is again disconnected. In between he was there, maybe related to connectivity, his connectivity. He messaged me in between and then I again messaged him and called him also. But we are thankful to Indian Medical Association for supporting our activity. He was there at the inauguration also in Defeat Diabetes campaign, which we have inaugurated on 1st July on Doctors Day. IMA is always there. IMA is our mother body, and IMA support is very much required when we are talking about the Defeat Diabetes, or when we are making glucose is a fifth vital sign. It's monitoring, because we all physicians and we all diabetologists, we always measure the blood glucose. Whenever a patient coming to our clinic is either for diabetes or either for any other medical problem where the glucose monitoring is very, very important. But IMA support is very much required. We want that glucose monitoring should be considered as a fifth vital sign. Unless an orthopedic surgeon or a gynecologist or a psychiatrist or a primary care physician will not understand the importance of glucose monitoring, it cannot happen. So we physician, without the help of IMA and without the support of IMA, this campaign cannot be there. So I mean, we are very much thankful to our IMA president, Dr. Jailal, for wholeheartedly supporting this event, for wholeheartedly supported for this Defeat Diabetes campaign. And now we can, if he's not there, we can request Dr. Amit for Gurudev.
Sir, I will, before I invite Gurudev, I will request you to deliver the message of Dr. Andrew Boulton. He could not join us today,
Yes.
but we spoke to you and he requested me to convey to you that you speak on behalf of him. So
actually, Dr. Shashank can talk because he is the IDF Southeast Asia chairman. IDF president wished us because last moment he joined and then he could not make it because of some ESD engagement. So he had just messaged me that I will not be available, but International Diabetic Federation is always there, and he wished all the best and congratulating us for this Defeat Diabetes campaign and 1 million tests. Over to Shashank if you want to speak on behalf of Dr. Andrew Bolton.
No, so Andrew is actually busy with ESD. He messaged me also. The International Diabetes Federation strongly with all the diabetic associations, and they are particularly pleased with the initiative of RSSDI and Bansi, you and your entire team. And they congratulate you for leading this wonderful advocacy come awareness initiative. And Andrew has personally sent his regards. He's also recognized that Anoop's contribution as glucose as a 5th vital sign. We had sent it to our board, and very soon IDF would like to take up that initiative in a very active way, and complication-free world with diabetes, which Dr. Mohan has alluded to. So I think IDF will always stand with the RSSDI, and once again it congratulates RSSDI in a big way. And as you know that as we are streaming live, ESD is being streamed live as well in Europe virtually, and which is why probably Andrew had a compelling commitment as a past president of ESD, and which is why, but he's always with us. He's always there for us. And IDF has, this is the year of the nurse, and soon it will be the year of insulin. And he's committed to diabetes educators, diabetes nurses, and IDF goal of the school for capacity building, for coverage, for access will remain. But I think what you have taken it, diabetes in India today, is that you have taken it to the next level, which is to screen as many people as possible, as quickly as possible in a single screenshot. And I'm certain that what you are doing today, Bansi, will lead to a nice publication. I'm sure our case is very capable and competent of getting out a nice publication with help of Amit and Purvi, and wishing from IDF side all the best for this event.
Thank you. Thanks, Shashank. I acknowledge here Dr. Vinod Kumar, who is our founder secretary of RSSDI and currently the patron of RSSDI. We also have the past president, Dr. Siddharth Das, who is also here, and many RSSDI executive committee member and many RSSDI senior leaders and members of RSSDI. Now I request Amit, if you can invite Gurudev, Shri.
Yes, sir. Now it's time to introduce our chief guest, who is none other than our beloved Pujya Gurudev, Shri Ravi Shankar. And to introduce him, I will request ICT team from the Art of Living to place a video which talks about Gurudev. Shiv, please go ahead and play the video of the Gurudev.
In an era when ancient wisdom was buried under years of ritualistic practices, when games became wars and wars were played like games, a young boy was found in deep meditation in a quaint village in South India known as Ravi Shankar. He would say, "I have family everywhere. People are waiting for me." He astonished his teachers by reciting the Bhagavad Gita at a tender age of 4. With his education in Vedic literature and physics and his deep and profound knowledge of the spiritual world, he became one of the most prominent sages of the modern world. All through his life, he has been reviving ancient knowledge and creating tools and techniques that have benefited millions across the globe in living a deeper and a more joyous life. In 1981, the Art of Living was established by Gurudev Sri Ravi Shankar. Nurtured by his care and contribution, the Art of Living has rapidly grown across 156 countries, reaching over 450 million people.
More people are searching harder for inner peace these days. Would you agree?
Correct. One of Gurudev's most unique offerings to the world is the Sudarshan Kriya, a powerful breathing technique that facilitates physical, mental, emotional, and social well-being. He has designed 57 exclusive courses that empower individuals and cater to the needs of a wide spectrum of institutions in the society. Back then, Gurudev started the Art of Living service projects by taking responsibility of reviving a sinking school which had no funds. Today, his intention has manifested in over 702 free schools, which provides education and food to more than 80,000 children in rural and tribal parts of India. During the COVID-19 pandemic, the Art of Living Foundation pioneered the I Stand With Humanity initiative, providing more than 80 million meals to the daily wage earners in over 170 cities across India. The service initiative during the pandemic included the distribution of 6,000 tons of food to 5 million families. It helped set up 7 COVID care hospitals and provided with over 200,000 PPE kits. Trauma relief programs were also conducted for more than 1 million migrant laborers and COVID warriors to bring mental relief. To combat the fear, stress and anxiety during such times, Gurudev launched the World Meditates campaign and also personally conducted online guided meditations twice daily, touching the lives of millions by bringing solace and keeping the hope alive. From childhood, Gurudev had immense faith in the principle of non-violence. With escalating violence and conflict in the world, Gurudev has brought peace in situations where war seemed like the only solution. Thousands of militants and Naxalites laid down their weapons and chose meditation in the northeast and other parts of India. His efforts include bringing an end to a 52-year-old fierce conflict between the FARC and the Colombian government.
Ojalá podamos los colombianos abrazar pronto el principio gandiano de la no violencia. Coincidimos con el maestro Shankar.
Gurudev has visited Iraq several times and addressed peace conferences to bring respite to the nation and its citizens. He has hosted a series of trust-enhancing interventions in Jammu and Kashmir, providing all the stakeholders to voice their opinions in an effort to restore peace in the valley.
I was named Muhammad, but after becoming a militant, I was called Khalid. We had been taught to operate guns, arms, and train other youths. But now, after doing the Art of Living course and meeting Sri Sri, we realized we had chosen the wrong path. We now want to spread love and non-violence in Kashmir.
Gurudev's programs have impacted people involved in armed conflicts across the world, making him a global ambassador of peace.
We gather today in this wonderful occasion of tolerance, blessed by our Master of Love.
Gurudev strongly believes that behind every culprit, there is a victim crying for help. The Art of Living prison program is helping to rehabilitate the prisoners. It has reached out to over 800,000 prisoners globally and has brought immense transformation in their lives.
I used to actually look forward to fights. But now since doing this course, I'm a total different person. I can now walk away from a fight.
I don't think any human being is totally bad. If he's bad, it's only his understanding, his behavior, his actions. But there is a good side to him, and I only see that.
The Art of Living's Welcome Home Troops project has transformed lives and brought veterans out of aggression and depression. 94% of these veterans who were suffering from the unseen wounds of war reported peace of mind and reduced stress and anxiety levels. The Art of Living has also been working towards the betterment of the environment. 48 rivers and thousands of water bodies in India have been revived. Conducted more than 100,000 cleanliness drives. Planted over 81 million trees in 36 countries. More than 2.2 million farmers have been trained to adopt natural farming till date. Gurudev found the Shri Shri Rural Development Program Trust to empower rural India. Volunteers have developed thousands of model villages across India, providing solar energy to over 90,000 individuals under Light a Home project. Gurudev's vast global network of volunteers is well known for mobilizing trauma and disaster relief for the affected populations around the world. In a world torn apart by religious, social, national and cultural divides, Gurudev's vision is to see the whole world as one family. The World Culture Festival. The festival brought together over 3.75 million people from 155 countries with spectacular performances on a breathtaking 7-acre stage equivalent to 6 football fields by 36,602 dancers and musicians from around the globe, celebrating the diversity of all faiths and cultures. The Art of Living has hosted historic events leading to multiple Guinness World Records.
If you can have a mind of a scientist and a spiritual force of His Holiness Sri Sri Ravi Shankar ji gives, then we have a beautiful world and happy world and prosperous world.
And organizing a meeting no politician on earth could ever dream of.
The Art of Living Foundation. For 25 years it worked on programs promoting peace, combating violence and drug addiction, empowering our youth. It has an incredible following that cuts through all religions, cultures and backgrounds. A very, very difficult thing to do in today's world.
Gurudev has been conferred with numerous awards around the globe, including the highest civilian award of Colombia, Mongolia and Paraguay, the Padma Vibhushan, one of India's highest civilian award, and 23 honorary doctorates globally. His vision for the world.
Namaskar.
Pranam Gurudev.
Amiji.
I would like to welcome you on behalf of RSSDI, Rotary India, VITO, and all the RSSDI doctors, Rotary members, Art of Living members who are present here. And Gurudev, when we visited you a month ago, as you all have always told us that take a sankalpa, and our sankalpa has been blessed by your spiritual blessings and divine blessings, Gurudev. So I will request you to address the gathering as a chief guest, Gurudev.
Thank you.
Let me congratulate all of you and commend the beautiful, commendable work that you're all doing. Defeat diabetes, such a beautiful slogan, much needed for today when our country is called the diabetic capital of the world. So I'm sure you all had great discussion on this, and 1 million people testing on one day is a very welcome beginning. I wouldn't say this is the end of it. This is a very good beginning that we need to go like there is yesterday 1 crore people in this country took vaccination yesterday in one day. Similarly, the next step for us is from 1 million to 1 billion people, 1 crore people, at least 1 crore to get tested on diabetes. As you all have already discussed, it is a lifestyle problem. It's a lifestyle issue. People have not been following a dietary system, balanced food, balanced exercise, or tension relieving techniques. And this would definitely lead them into more heightened sugar level in their blood. Well, after COVID, we have seen that post-COVID, a lot of people complain of rising sugar levels. So here, I'm sure you all in this process of creating awareness, you have already appealed to people. But when you appeal, it has more value. In Karnataka, there is a saying, Shankadinda Bidrene Tirtha. That means जब वो जो जल होता है उसको शंख में लगा के फिर देते हैं तो वो तीर्थ हो जाता है. So when things, lifestyle improvement and dietary improvement and these things come from the doctor, people follow it. In this country, there is great respect for medical professional from long time. That's why the scriptures also say, Vaidyo Narayano Hari. Vaidya is synonymous to Narayana and Hari. That means like Narayana takes care of the world, Vaidya takes care of the body. Vaidya means doctor. I don't mean only Ayurvedic doctors, but doctor in general, medical professionals in general. So there is so much respect in society for this profession and they need to have that. But in the near past, there has been some issues on that and we all have raised voice against violence and prejudice that we have seen happening in society. Violence is also a sort of illness. I wouldn't consider a person very healthy if he has bouts of violence tendencies. So a healthy mind is a sign of healthy body and vice versa. For this, we need to have a holistic approach. I'm sure you all agree with me. Tension-free mind is very important to have a very healthy healthy body. And so, does it affect the behavior? If someone is physically not fit, mentally not sound, definitely their behavior pattern is seriously affected. And then we have no peace in family. When one person is not behaving properly in home, it affects the whole family and it affects the whole mohalla also. So to have a healthy, happy lifestyle, we have to go in for a holistic approach where we teach them what to eat, how to eat, and when to eat these things, and then how much exercise everybody need to do. Here, I would also recommend all the doctors and medical health professionals who are here. Pranayam and meditation also can make a big impact. You know, we use not so much of our lung capacity. When we do pranayama kriya, there is sense of well-being that wells up from within us. And when you feel well in the mind and, you know, it impacts our endocrine system, and the number of research work has happened to this effect as well. Now, you are the experts in your field. I would urge you also keep an open mind when it comes to yoga and meditation and pranayama. At the same time, Ayurveda also has some solutions. It gives us the diet. It gives how we should manage our dinacharya, daily routine. These are some things also we can incorporate and tell people and see, like Karela, for example, it's good, or what fruits are good for you, what vegetables are good, especially people who have high glycemic, you know, people who have high sugar. Then along with this, I would say happy state of mind. That matters. A strong mind can carry on a weak body, but not the other way around. So hence, to make one's mind strong, a little bit of broadening of their awareness, broadening of mindset. This is necessary. What do you think? I'm sure you will all agree with me. A broad mindset is a way to, I would say it's a vaccination for stress and tension. If your mindset is so narrow and small, that you are susceptible to tension and stress much quickly. So a broader outlook towards life, bigger context to life, purpose to life, meaning to life. Let me congratulate here the Rotary as well. Rotary gather everyone to initiate service activity, and when people are engaged in service to society, their mindset changes. People start thinking bigger, not just me and mine to we move on to say, let us do something together, let us care for this planet. Or when we come from this broader mindset, we would acquire less of tension, less of stress, and we can keep ourselves healthy. I often say there is a formula to get depressed. Do you all want to know? Just sit and say, what about me? What about me? What about me? This is the perfect formula to get depressed. So when person comes out of this cocoon and connects with people in the society, starts caring and sharing themselves with others around, lot of improvement can happen in their health, in their outlook towards life, and the way they see themselves as well. So with these few words, I would say once again, it's a great initiative. Let's all make this happen more often in all parts of the country and keep or make our country free from diabetes. As I said in the beginning, it's type 2 diabetes can be corrected by lifestyle. This, many of you have already said that. So little change in that, understanding, community welfare activities, all these would immensely benefit to push the health index of our country to higher, to newer heights. So once again, congratulations to you all for the wonderful work you do. Keep doing the work and do not neglect your own health also. I have seen that many doctors are too busy, too much caring, and you undergo burnout. And if you feel that burnout, just dial Art of Living number anywhere nearby. We have places for you to come and relax and chill and get rejuvenated once again. Yeah, your life is very, very important. And please take care of your health. And do not forget to take those 10-20 minutes for yourself to relax and meditate. Often people think meditation is focusing, concentration, it is doing something. No, it's not. Meditation is a deep relaxation. I would say it is a conscious relaxation. And that you can experience just 1 or 2 guided meditation you sit through. You will see you can do it on your own, anytime, anywhere, in between your operations, when you're waiting for your patients or doing something. Those 10, 15, 20 minutes you can take to rejuvenate yourself, doing some 5 to 10 minutes of pranayama, breathing exercises, can, keep your energy level high. With these few words, I say it was my privilege to be with you all today and talk to you. And God bless you all. Be happy. Blessings, blessings, love and blessings to everybody.
Thank you, Gurudev.
Thank you.
Your presence makes everyone smile, and I can see that smile on everyone's face, Gurudev. And I will request Dr. Bansi Sabu sir to say something to Gurudev.
So it's a great moment, and very the moment itself that with the Guruji presence we all feel blessed, and as we are going to have this 1 million test with the Ashirwad of Guruji, before 1 month we were there personally to meet and to take the Ashirwad and blessings from Gurudev. Now this dream come true, and we are sure that with the blessings we are going to achieve this number. And as he told, it should not be 1 million. Probably in near future we should make it 1 billion. And I am sure with the blessings and with the support of Art of Living Foundation, we will able to test maybe in a year or 2 years for 1 billion. But our idea is to make that we should make our country diabetes care capital of the world. We want to make our diabetic patients for complication-free world. They should not develop complication. And we want to make everyone aware about the sugar monitoring, which is very, very important. Our Defeat Diabetes campaign have 3 T: test, track, and treat. So we want to make them early and aggressive, and they should be treated for prevention of the complication. Thank you, Gurudev. Thanks for your blessings.
Amit, let me just have one word of thanking Gurudev. We will never forget this evening of spending a few minutes with you. We'll always listen to your preachings and in the service of the people. And thank you very much. We are grateful to you, Guru.
Thank you. Amit, now I request you for formally vote of thanks.
Thank you, Dr. Bansi sir. It has been a phenomenal evening today, and we are at the evening of our record creating day. Tomorrow we are going to test 10 lakh people in 1 day at more than 10,000 sites all across the India, and this is going to make a history. And this has happened with the blessings and support of so many people. First of all, I would like to thank Gurudev Shri Ravi Shankar and Art of Living Foundation for blessing this project, and that is why we are here today. And with these blessings, we are sure that we are going to achieve the target tomorrow. At the same time, I would like to thank our guest of honor, the Rotary International President, Mr. Shankar Mehta, and also the President of the International Diabetes Federation, Dr. Andrew Bolton, for their extended support. Because of that support from the Art of Living, Rotary International, and the International Diabetes Federation, this project has a global reach now. And I am sure in coming days, many other countries will be doing similar things and following RSSDI as a leader. I would like to thank all the past presidents. I would like to thank all the patrons and the current executive committee members of the RSSDI for guiding all through this campaign and giving their valuable advice at all the possible time. Whenever we went to them, they gave us their valuable advice and guided through this campaign. And everyone is participating with full heart tomorrow for this word creating campaign. I would also like to thank all the state chairs, secretaries, and the office bearers of the RSSDI and the district coordinators of the RSSDI who have done a commendable job over the last 80-85 days. It is very, very important to mention and to thank the Rotary India and the support of the Rotary International Directors, Dr. A.S. Venkatesh and Dr. Mahesh Kodbagi, who has always been there as a support to support our campaign. And Rotary has created more than 4,000 sites all across the India, and they are all geared up to test almost more than 5 lakh people tomorrow by the Rotary alone. So many, many thanks to all the Rotary people, all the Rotarians who are watching this telecast, and special thanks to Dr. Bal Inamdar, who has been coordinating this and working tirelessly for this event, and Mr. Vishwajit Ghosh, who is coordinating all the meetings to make it happen. It is very, very important that we know that to conduct such a mammoth event needs huge logistics. And for the logistics, I would like to thank Gautam Chopra, who is here, who is the founder of the BITO. And the BITO has helped us in really supplying the glucometers and the test strips to almost more than 2,000 places all across the India and they have completed their supplies. Almost 99% of their supply is complete, and the Rotary people are having those supplies. And tomorrow we are going to use those supplies. So thank you, Gautam, for your extended support. It is very, very important to thank the Torrent Pharma, because Torrent Pharma has helped us in conducting the FM campaign, which is going on in many cities and will still go on, keep on going in other cities also. And they have support. They are distributing the educational materials to more than 18,000 doctors. So I would like to thank Gagan Etreja, who is India head of the business for the Torrent Pharma, for this their extended support and their for this campaign. It is very, very important to mention and thanks Roche as well as the VOCAD, who has actually agreed to Dr. Bansi sir's request, and they have I don't know how they managed, but within 7 days they could manage the supplies to the most of the India. And till yesterday evening, the VOCAD people, they were airlifting the products so that it can reach to the maximum possible people in time. I am sure many of you have received your goods, but if still you have not received your goods, we will assure you they are on the way. You may receive them tomorrow or day after tomorrow, but please go ahead with your camp and conduct the camp and conduct the testing. This is what I would request. Such a large scale event cannot happen without the team, with the IT team. So we have a large IT team in which we have support from the Jandra Healthcare. The Amisha is there, Dr. Ami is there, and we have Mosley, who is working with the RSSDI for last 1.5 years and for creating all those things which is there. Last but not the least, it is very, very important to mention my own Defeat Diabetes Task Force members, Dr. Rakesh Parekh, Dr. Nandita Arun, Dr. Purvi Chawla, Dr. Supratik Bhattacharya, Dr. Sachin Chitawar, and all the RSSDI ambassadors who are tirelessly working for the last almost 85 days. And they are tweeting and sending all the comments, and they are actively participating in all the activities of the RSSDI. I would once again thank to the RX team, who has also been phenomenal in giving us all the platforms on which we conduct our CMEs or our events. I would like to thank Dr. Hardik and the Neelam for their extended support. And now it is a sincere request that tomorrow it is our day. It is our day that we can create a history. And I am sure with the guidance and the leadership of Dr. Bansi Sabu sir and all the leaders from the RSSDI, we will be able to achieve that. Thank you. Thank you very much. If I have forgotten somebody's name, I beg your pardon for that. And tomorrow we will love to achieve our target. Thank you. Thank you again.
Dr. Amit, just a request. Our director, Dr. Mahesh, has just joined. Can he speak for 2 minutes?
Yes, sir. Please.
Dr. Mahesh?
Dr. Mahesh,
I don't have to speak anything. I just want to say the team of RSID is great. And I think my words have come true. I said this 1 million is a too small number. And I think Rotary, and with the blessings of course, Sri Gurudev Ravi Shankar ji, has been, very, very wonderful task. All the best. And I have been getting great feedback. Last 10 days, I was traveling in 7 cities. Today I'm in Nandial. Yesterday I was in Hyderabad, earlier in Ujjain and Indore. I think Diabetic Research Society stage has come to every small city. And I think the success is 100% sure. Let us work together. With these my words, and I think with great speech of Sri Ravi Shankar ji, I don't want to continue any talks further because it's just a coincidence that he is Shankar and I am Mahesh. That's it. But other than that, I cannot talk anything. All the best so much.
Thank you. Thank you, sir.
Congratulations to everyone and best wishes to all of us.
All the very best. Congrats.
All the best. It was
all the best.
Let us achieve it. And
congratulations.
Give me a show again to everyone that yes, we achieved it.
Thank you, sir. All the best.
All the
best.
Dr. Mohan sir and Dr. Anup Mishra, we will be sharing the data also.
Definitely.
To everyone, and this data will remain with RSSDI, so anyone of us can see the data.
We should write this up. We should write